Hello everyone, I'm Dr. Benton. Today, I want to take a little time to talk about a topic that may seem simple, but is actually extremely important for our health, especially for older adults. How to measure blood pressure the right way. Why do I say this is so important? Because high blood pressure, what many of us call the silent killer, often gives no warning signs. You don't feel sudden pain or symptoms right away, but over time, it quietly damages your heart, your kidneys, even your brain. I've seen so many of my patients in their 60s, 70s, and even 80s misdiagnosed with hypertension, simply because their blood pressure was measured incorrectly. Many of them ended up taking medications for years that they didn't truly need, suffering side effects along the way. On the other hand, I've also seen the opposite. People who thought their blood pressure was fine, when in reality, the way they measured it gave a falsely low reading. By the time the truth was discovered, the disease had already progressed, leading to heart failure or a devastating stroke. That's why today, I want to guide you through 11 of the most common mistakes people make when measuring blood pressure at home. I won't just list them, I'll explain them clearly so you can remember and apply them right away. My hope is that every one of you watching, especially my older viewers here in the United States, will know how to measure blood pressure properly, monitor your heart health more accurately, and avoid dangerous misdiagnoses. Mistake number 1. Wrapping the cuff over clothing. This sounds simple, but I see it all the time, even in clinics. When you place the cuff over a shirt, sweater, or any fabric, the machine records higher pressure than what's real. Sometimes 10 to 20 millimeter timers of mercury higher. I once had a patient in her 70s who was told repeatedly that her blood pressure was sky high. But after asking questions, I found out the nurse was always placing the cuff over her sleeve. At home, when she measured directly on bare skin, her blood pressure was completely normal. Lesson: always measure on bare skin. Don't roll up tight sleeves or measure over thick clothing. Mistake number 2. Arm not at heart level. Your heart is in your chest, but many people let their arm hang down while measuring. This gives a reading that's falsely high. Too tight, falsely high reading. Too loose, falsely low or inconsistent reading. Remember, 2 fingers snug. Mistake number 4. Not resting before measurement. Blood pressure must be taken when the body is fully at rest. If you measure right after climbing stairs, rushing, or feeling stressed, the number will be much higher. Many patients come into the clinic, walk quickly from the parking lot, sit down, and immediately get measured. Their reading is 20 to 30 millimeters of mercury higher than their true resting level. Correct way: sit quietly for 5 to 10 minutes before taking your measurement. Take slow, deep breaths, relax your muscles, and calm your mind. Mistake number 5. A full bladder. Few people realize this, but a full bladder actually raises blood pressure. The body activates the fight or flight nervous system, increasing the reading by 10 to 15 millimeters of mercury. Tip: always use the restroom before measuring. Mistake number 6. Crossing your legs. It may feel comfortable, but crossing your legs makes blood pressure rise slightly. That's because blood returning from your legs to the heart changes circulation. Correct way: sit with both feet flat on the floor, uncrossed. Mistake number 7. Drinking coffee or caffeine before measuring. Many of us love our morning cup of coffee, but if you take your blood pressure right after, your reading may be 20 to 40 millimeters of mercury higher, and caffeine can affect your blood pressure for hours. Tip: avoid coffee, strong tea, or energy drinks for at least 2 to 3 hours before measuring. Mistake number 8. Measuring on the wrong arm. The standard worldwide is to use the left arm, since it's closer to the heart. The right arm can sometimes give different readings. Only use the right arm if there's a medical reason, like surgery, pain, or lymph node removal. Mistake number 9. Using a wrist monitor instead of an upper arm monitor. Wrist monitors are small and convenient, but much less accurate. They are very sensitive to how high or low your wrist is compared to your heart. Best practice: Use an upper arm monitor, which is the gold standard. If you must use a wrist monitor, keep it exactly at heart level and compare it regularly against a Mistake number 10. Talking while measuring. Some nurses and even patients chat during the measurement, but talking changes heart rate and blood pressure, giving an inaccurate result. Correct way. Sit still, breathe normally, and stay quiet until the machine is done. Mistake number 11. Measuring only once and making conclusions. This is the most dangerous mistake. Blood pressure changes minute by minute. If you only measure once and conclude you have high blood pressure, that's misleading. Correct way. Take several readings at different times of day while at rest. Use the average. Doctors diagnose hypertension based on multiple, consistent readings, not one single number. I hope today's video helps you better understand how to measure your blood pressure accurately and avoid these common mistakes. Health is our most precious gift, and with just a few small habit changes, you can avoid unnecessary medication, prevent serious illness, and protect your heart for years to come. If you found this video helpful, please subscribe to the channel so you don't miss my next health tips. And I'd love to hear from you. What challenges do you face when measuring your blood pressure at home? Leave a comment below, and I'll read them and give advice in upcoming videos. Stay healthy, and I'll see you next time.